Helen Keller International, HKI, is one of the oldest international NGOs operating in Kenya, Africa, and the Asian Pacific region, whose mission is to save the sight and lives of the most vulnerable and disadvantaged in the society. In Kenya, HKI centenary celebrations were held at a Nairobi hotel, where speakers addressed the issue of malnutrition in marginalized areas. According to the 2014 Kenya Demographic Health Survey, roughly 4 out of 5 children suffer from stunted growth, the result of inadequate nutrition in the first 1,000 days of their lives. Key speaker Ido Dinga noted that 45% of children under 5 years in Kenya die due to one or more forms of malnutrition.
It's the key to further development in this country, particularly among the mothers and children. When the babies are born and they are not properly fed, and if they are born underweight as a result of mothers not eating the right food during the pregnancy, definitely those children will get stunted. By the time they are 2 years old, they've lost the essential part of nutrition that they require for maximum growth. A healthy mothers gives birth to healthy babies, and healthy babies as a result become healthy adults that can be able to help our country to grow further. Therefore, the issue of health and the issue of nutrition should be recognized and be dealt with right from the day of conception to the time when the child grows up.
HKI Senior Vice President Victoria Quinn said they are seeking long-term solutions by training health staff and volunteers, as well as partnering with government, private businesses, and community-based organizations to improve traditional gardening and farming practices.
The good news is we do know what to do about malnutrition. HKI's programs provide foods full of all sorts of vital nutrients to protect the health and well-being of families and children worldwide. We work with the private sector to add essential vitamins and minerals to staple foods, such as vitamin A to cooking oil and iron folate to wheat flour.
HKI works with Ministry of Health and county governments to strengthen health systems.